Hi guys, today we will be talking about prescription opioid abuse. So what are opioids? They are basically narcotics used to help people dealing with severe pain. They work by attaching to proteins called opioid receptors in the brain, and some of the names that they go by are codeine, fentanyl, hydrocodone, oxycodone, and morphine. They are sold under the brand names Oxycontin, Percocet, Paladone, and Vicodin. However, opioids do have a lot of negative side effects, and some of them are increased sensitivity to pain, constipation, nausea, vomiting, dry mouth, and the list goes on. So, a brief history on opioid abuse. At one point, there was a non-crush resistant form of the opioid, which was meant to help to stop people from breaking it down to a powder form to snort or to smoke it, but the patent expired, so the abuse did continue. So, what is the issue? More than 191 million opioid prescriptions were dispensed to American patients in 2017 across the states, and this is a problem because it is a record high to have this many prescriptions of opioids. The U.S. Department of Health and Human Services in 2017 declared a public health emergency. It's become a national problem because there have been more than 42,000 deaths in 2016. 40% of overdose deaths involved a prescription opioid, and there is a variation across the states. So, for instance, in Alabama, they wrote 3 times as many opioid prescriptions per person compared to the lowest prescribing state of Hawaii, just to show that it isn't the same in every single state. The issue continues because the abuse of opioids also leads to other problems. Injections has led to the spread of diseases including HIV and hepatitis C. When the abuser runs out of the prescription or the ability to get a refill on the prescription, they turn to heroin because it fills the feeling that the addictor wants. What is being done to combat the issue? So there have been electronic prescription monitoring programs, which is basically when a physician can go onto an online database and enter the person and how many times they have prescribed this person, so the person can go from doctor to doctor trying to get multiple opioid prescriptions. And this is supposed to work, though the negative side effect is that not all physicians or all states are actively using this. Professionals are now required to consult the patients before they get the prescription, and the U.S. Department of Health and Human Services implemented the 5 priorities to help. Medications used to combat. These medications are methadone, buprenorphine, and naltrexone. Methadone and buprenorphine are the ones in the first 2 photos, and methadone works by filling exactly into the opioid receptor, so it's known as a full agonist. And buprenorphine is a partial agonist, as you can see, because it barely fills into the receptor, but it does to a certain limit. And these 2 work by tricking the brain into thinking that it is getting the full opioid. And then the last one is naltrexone, which is an antagonist because it does the opposite of fitting into the receptor. It doesn't allow opioids to go in at all. The other one to combat is naloxone, and this works by reversing an opioid overdose by knocking the opioid off of the receptor, although it only lasts for 30 to 90 minutes, which is crucial time for the person to get to the hospital to get the full help in order to get over the overdose. And it comes in 3 forms: nasal sprays, an injection, and a small machine, though the prices do range significantly. The nasal spray is $350, the injection is $800, and the machine is $6, but the only reason why it's so cheap is because it's very hard to work the machine. All 3 of these are easily accessible in most states, and some of them are over the counter. Anyhow, there are precautionary steps besides naloxone that you can take. The 3 steps are talking, preparing, and finding. Talking to your physician about minimizing the risks and side effects. Preparing for surgery before and after. And this basically means if you know you're about to go into surgery, talk to your physician and let them know how many opioids you are taking, if you are on it, or if you do or don't want to take it after the surgery and you want to deal with the after surgery pain in a different way. And that goes to the findings. So finding other options such as non-drug therapy, such as biofeedback, meditation, massages, acupuncture, and other forms. And the next few slides are basically graphs showing, the next few slides are maps showing the U.S. effect of opioids. So the first one is the status of prescription monitoring programs. And as you can see, most of the country has a state with an optional monitoring program, but it's not required. And then this one is the abuse over time. So the darker blue is a smaller amount. So it goes from 0 to 2, 2 to 4, and then it increases all the way to 28. Estimated age adjusted death per 100,000 people. And then as you can see over time, the darker colors have significantly gone away and it's turned into red. And not only a certain part of the country, but almost all over the country, the abuse has increased over time. So even though there have been a lot of helps or priorities put into place, or the US Health Department trying to put other things into place to help, the abuse continues because it leads to riskier behaviors because people believe that if there is an easy fix to it, why not continue? So even though there have been significant changes, the abuse does continue over time. So that is a little bit on prescription opioid abuse. Thank you.